the next section that we're going to talk about is the thyroid gland. This is a common area where test questions come from. So we'll talk extensively about mechanisms of actions and tests to do. The first thing I want to talk to you a little bit about general aspects of the thyroid. So here's the thyroid right here. This is what happens in the thyroid. You basically uptake all the iodine in the body, maybe about 96-97%, and you make thyroid hormones out of that, and the main secretory product of the thyroid is T4. So the main hormone that you make from the thyroid is T4, and then in the periphery, right here, somewhere in the periphery, this gets converted mostly to T3. T3 is more potent. T3 is more potent. There's a better effect on the tissues from T3. So basically, the thyroid secretes mostly T4, and then you get T3 conversion in the periphery, in the tissue where you have all the metabolic effects, and T3 is more potent. Now, you're going to see here that it's right here that when you secrete endogenous T3 and T4, we said mostly it's T4, but there's some T3 excreted too. You co-secrete it along with this thing called thyroid binding globulin. This is very important. It's a very important test that we do sometimes to see if the thyroid hormones are endogenous or not. So thyroid binding globulin. It's a very important test. It tells me that all these thyroid hormones are endogenous. Now, if you look at here a little bit on this chart here, you'll notice also that there's a feedback from T3, T4 back to TSH, right? So the hormones that get regulated is the feedback loop back to the pituitary is through TSH, and then at even higher level, hypothalamic thyroid releasing hormone, all the way up here. So the main secretory product of the thyroid is T4. It gets co-secreted with thyroid binding globulin. Most of this becomes T3 in the periphery. It has all the metabolic effects, and these both hormones, but mainly T3 because it's more potent, has the feedback loop back to the pituitary with TSH and back to the hypothalamus with thyroid releasing hormone. Now when we measure thyroid hormones in the periphery, we like to measure only free hormones because only the free hormones have the metabolic effects. So out of the total T4, only 0.01% is free. So let me say this again. Out of the total T4, only 0.01%, even less than that, is free T4, but that's the one that has the metabolic effects on the body. And the same thing with T3. 99.99% is protein bound. Albumin and stuff like that bind that. So it's very, very important that you understand that when you measure thyroid hormones in the periphery, you're only looking for what says free T4, free T3. That's the only ones that really give you a good idea of what's going on with the thyroid, not the total T4. The total T4 will change depending on the albumin in the body. For example, if a patient has nephrotic syndrome, your total T4 will go down because you're losing albumin. But your free T4 is normal and your TSH is normal because the feedback is through the free T4, right? So that's why we only ask for the free T4. If a patient is pregnant or is taking estrogen, then your total albumin and your total protein in the body goes up. And so does your total T4. But your free T4 is normal, and so is your TSH. So please be careful when you're asking for, and this is in clinical practice also, when you're asking for thyroid hormones, what you're asking for, make sure you're checking off free T4, free T3, you don't want to know total T4. That could be misleading. You don't want to know T3, total T3. That's also misleading. The best initial test to do in patients with undiagnosed thyroid disease, if you're looking for thyroid disease, is a TSH. The TSH is the most important test to do in people when you're looking for thyroid disease. The new types of TSH, the third and the fourth generation of TSHs, are very sensitive and they're very specific, and they could document both hyper and hypothyroidism with a 95% confidence interval. Very important test. If the thyroid stimulating hormone level, the TSH, is normal, that patient is euthyroid. So I'm going to say it again. If you check a TSH and the TSH is normal, that patient is euthyroid. I don't care what clinical symptoms this patient has. So that's the first test you look at. And then you look at the free T4 and the free T3 to make the right diagnosis. Another test that we do is sometimes we measure this thing called the thyroid binding globulin. Here it is.